The BHSc program is basically the 4-year honors program where we offer an art and science to design, develop, manufacture and the effective use of medication.
One of the years they have to actually do it abroad, and the other one will be encouraged to do locally. So where they'll be working for JPMC or Ministry of Health. We have a few places they can actually work at the hospital, at our community health clinics. That's where they will be assigned to if they are working locally. About abroad, there will be research internships. So they'll be working with different research departments on formulation, on pharmaceutics, and also on pharmacology and cancer research. They have already been sent to Korea, Thailand, Malaysia, Indonesia. We have collaborators all over these countries, and we do send our students there as part of their discovery year experiential learning.
As a Gen X program focus on the experiential learning. So that's why we have the discovery year program where students have to leave their UBD learning environment and they have to go abroad to learn independently all the skills required. It means the collaborative skills and the learning skill outside the UBD environment and so on. And our aim is they get excellence in learning about human physiology, anatomy, pharmaceutics and so on. And in addition to that, we ask them to build up their communication skills so they can take care better when it comes to the patient dealing, and not only patient, their families as well, and how can they be more effective in giving the message how to use medication safely and effectively even for the elderly patient at home as well.
To me, leadership and empathy is also very important. Being caring to the patient, understanding the patient, and giving patient empowerment.
I always tell to the student to go for higher studies like masters and PhD, and also very specialized program like regulatory pharmacist, regulatory pathway, which is highly paid job, as well as the Brunei is depending on some other radiopharmaceuticals. I tell to the student to go to study for radiopharmaceuticals 1 to 2 year program in abroad, so that they will bring the technology so that they can do the radiopharmaceutical services in Brunei itself.
3 years back, I was being admitted to a hospital due to food poisoning, and I was given a lot of medications. And that experience made me curious on how the medications work and able to treat diseases.
Truthfully speaking, I find my course to be heavy and quite rigorous, as we learn a wide range of pharmaceutical knowledge. However, I still find my work-life balance to be healthy, as I still have the time to join multiple clubs and join sports activities.
Yes, definitely. I think how I overcame those challenges was by surrounding myself with the right people, and I did exactly that. My friends really helped me a lot, both emotionally and mentally. They were my go-to people whenever I struggle with any subjects and just pharmacy in general. And I think having a good bond with your lecturers is equally important as well. They truly care about their students, and my lecturers specifically, they helped me a lot whenever I reached out to them. When I first started pharmacy, I thought it was all about chemistry and dispensing medicines. However, throughout the years, my understanding changed a lot, especially now that I'm doing my DY. Pharmacy also involved patient care, clinical decision-making, controlled drugs regulatory affairs, and it's much more than just dispensing medicines, which all of these aspects were blurry to me in my first year, but now it has became much more clear.
Okay, so I would like to emphasize here about the misconception about the pharmacy profession. Most of our students or the ones who are interested in our pharmacy program think that the scope of pharmacy is limited to either community pharmacy or hospital pharmacy. But I would like to emphasize here the scope of pharmacy is very broad. It's very huge. So in terms of either you can work in community pharmacy or hospital pharmacy. Apart from that, you can work in pharmaceutical industry, research and development, manufacturing, regulatory affairs, quality control and quality assurance in regulatory bodies, in pharmaceutical marketing, in journalism, scientific writing, and also in academia to train the future pharmacists. So once you have the BHSc Pharmacy degree, the scopes are enormous. It's not only limited to the hospital and community pharmacy.